Good morning, everyone, and welcome to the U.S. Access Board's Artificial Intelligence Virtual for the Disability Community. My name is Elber Ariza Silva. I am a public member of the Access Board appointed by the President Biden in 2022. I serve as the Vice Chair of the Board, and I live here in Washington, D.C. area. The Access Board's mission is to create access for all. The Access Board is an independent federal agency dedicated to accessible design for people with disabilities. The board is comprised of 25 individuals, 13 of whom, like me, are appointed by the president, and the other 12 are representatives from various federal departments. I would like to acknowledge my fellow board members that have joined today's hearing and thank them for being here today. I would like to take a moment as well on behalf of the board to additionally thank all of today's presenters and those in attendance for being with us today as we discuss artificial intelligence in relation to the disability community. A few housekeeping notes as we begin. This hearing is being recorded. American Sign Language interpretation in real time. Captions are being provided. All attendees will remain muted and with your cameras off unless you are being called upon to speak. You may use the chat feature to the host if you need assistance. For all board members, presenters, and pre-registered to offer that the name you are listed on Zoom is your full name so that we can easily identify you and provide you the permissions needed to speak at the hearing. Once on the screen, you will find the agenda for today's hearing. After my welcoming remarks, we will begin the hearing with Allison Levy, Director of the Office of Technical and Information Services for the Access Board, who will provide some foundational background. And then from Judy Brewer, Assistant Director of Accessibility at the White House Office of Science and Technology Policy, to learn more about the Executive Order on Artificial Intelligence and the Office of Management and Budget memo. After Allison and Judy, we will hear from a wide range of presenters on the uses, benefits, and risks and barriers for people with disabilities regarding artificial intelligence. Following these presentations, Access Board members and staff will be panelist questions, comments from those that have pre-registered to provide public comments. Let us begin by welcoming Allison Levy. Allison?
Thank you, Elver. I'm going to provide you with some basic information about why we're here today. First, I wanted to share a little information about the U.S. Access Board for those of you who aren't familiar with our roles and responsibilities. Next slide, please. We have three basic functions. The first is to establish accessible design, guidelines, and standards. And this includes the Architectural Barriers Act, the Americans with Disabilities Act, and Section 508 of the Rehabilitation Act, as well as others. Our second function is to provide technical assistance and training on accessibility standards so that we are creating a more accessible world for everyone. And third, we enforce the Architectural Barriers Act standards, which apply to federal owned and leased facilities. Next slide, please. In reference to the executive order, which was issued last fall, and Judy will be sharing more detail about this, we've been charged to help ensure that we're reaching out to disability community. There is a link in the chat to the executive order, I believe, and you can dive a little more deeply into that on your own, as well as Judy's description. Next slide, please. Specific under the executive order, the Access Board was charged with several tasks. So the first one is soliciting public participation and conducting community engagement. The second is issuing technical assistance and recommendations on the risks and benefits of artificial intelligence, including the use of biometrics and data input. Providing people with disabilities access to information and communication technology and transportation services are also key to our task from the order. And to help us fulfill these requests, we reached out to 2 disability organizations who have been invaluable with their knowledge base and their outreach efforts. Next slide, please. To help form a stronger partnership, we developed a memorandum of understanding with the Center for Democracy and Technology, otherwise known as CDT, and the American Association of People with Disabilities, known also as AAPD. Together, we've been working on developing these hearings, the agendas, and as a capstone to all of the hearings, we anticipate issuing later in the calendar year some form of guidance and recommendations based on what we've heard from the disability community, AI practitioners, and federal agencies in their role under using artificial intelligence. Next slide, please. Next, I'm very pleased to introduce to you Judy Brewer, Assistant Director of Accessibility at the White House Office of Science and Technology Policy. She's a great support, excuse me, to us, and we're so happy for her to join us today to share a lot more detail with you about the executive order and her work. Judy?
Thank you, Allison, for the opportunity to provide background for this U.S. Access Board hearing on artificial intelligence, AI, for disability community and AI practitioners. I want to check that my sound and my image are coming through okay.
You're good.
Great, thanks. I currently serve as Assistant Director for Accessibility in the White House Office of Science and Technology Policy, or OSTP for short. At OSTP, we work on harnessing science and technology to achieve the nation's aspirations, while also mitigating risks of those technologies and ensuring equity, inclusion, and integrity in science and tech. OSTP works across climate and environment, industrial innovation, health outcomes, national security, science and society, and technology. AI has been a core focus of OSTP during the administration. President Biden and Vice President Harris have been clear that we must manage AI's risks so that we can harness its benefits as a nation. As part of ensuring that America leads the way in seizing the promise and managing the risks of AI, OSTP issued a blueprint for an AI Bill of Rights in 2022. The president issued an AI executive order in 2023, and the director of the Office and Management Budget issued a policy for federal use of AI in 2024. If after today's hearing, you wish to study these more closely, and I hope that you do, you can find the executive order simply by searching for AIEO and the AI policy memo by searching for M2410. And I believe the Access Board has those links available in the Zoom chat. Please note, I cannot see the chat. The executive order establishes new standards for AI safety and security to protect privacy, advance equity and civil rights, stand up for consumers and workers, and promote innovation and competition. The policy memo on federal use of AI establishes new agency requirements and guidance for AI governance, innovation, risk management, including for AI equity issues. Many of these requirements have implications for disability equity. We appreciate the Access Board stepping forward together with the Center for Democracy and Technology and the American Association of People with Disabilities to help fulfill the goals of the executive order. These goals include public participation and community engagement encouraged in the AIEO, Section 7.3D. It's important that federal government gets input from the disability community on risks and benefits of AI for people with disabilities. Vice President Harris stated upon publication of the executive order that she believes that leaders from government, civil society, and the private sector have a moral, ethical, and societal duty to make sure that AI is adopted and advanced in ways that protect the public from potential harm and ensure that everyone is able to enjoy its benefits. Let me offer some examples of practices that support equitable use of AI. These are from the policy memo, where disability perspectives may be relevant. The AI policy requires annual reporting of federal AI use cases. Use cases are practical examples of how AI may be applied to a range of situations relevant for specific topics. For instance, benefits determination, screening of job candidates, or emergency evacuation procedures. Agencies must individually inventory each of its AI use cases at least annually, submit the inventory to the Office of Management and Budget, and post a public version on the agency's website. Agencies will be required, as applicable, to identify which use cases are safety impacting and rights impacting AI, and then report additional detail on the risks, including risks of inequitable outcomes that such uses might pose, how agencies are managing those risks, or otherwise they may remove the risk impacting AI. As an example, in AI-enabled workforce surveillance, one could consider whether there's a risk that a characteristic associated with a disability, such as a movement disorder or speech difference, might be unfairly assessed. The AI policy requires periodic human review of AI systems, sometimes including human intervention and vigilance over human-machine teaming problems such as automation bias. Human review of AI systems to audit how AI is making decisions and whether AI-enabled decisions appear fair can be an important safeguard on how AI is used. Automation bias is the risk that human reviewers might defer their judgment to the AI system that is being assessed rather than exercising their human judgment. If there is an important knowledge base that human reviewers should be trained on to avoid the risk of automation bias in human review, that would be helpful advice for federal agencies to know. So these are just a few examples that I've provided to show how disability-informed perspectives may be important for ensuring effective implementation of equity protections in the AI policy. There are additional opportunities for disability perspectives, advice, and guidance in the policy for the government's use of AI, including opportunities for AI to advance accessibility and equity. Recently, OSTP held an AI aspirations event to think big about AI capabilities that we could build to achieve our aspirations in health, climate, and so forth. OSTP Director Arthi Prabhakar invited everyone at the event to offer their own aspirational suggestions for national AI capabilities. For accessibility, there's sometimes a risk of seeing AI as a quote-unquote silver bullet or promoting its premature use to accelerate the creation, assessment, or remediation of accessible content. Prior commercial efforts to automate digital accessibility have not always met the needs of people with disabilities, and some approaches have been strongly protested. Similarly, significant error rates are common in automated speech recognition, automated image recognition, and automated ASL generation. Accuracy strongly impacts whether captions, descriptions, or auto-generated ASL actually meet the accommodation needs of individuals. The AI policy memo directs agencies to involve impacted communities in federal agencies' development and use of AI. Ongoing direct involvement may be important to engaging people with disabilities in the judicious design of accessibility improvements while avoiding overclaims of current AI benefits. Finally, I'll highlight two additional areas where advice could be useful: AI workforce and AI governance. The AI executive order and AI policy memo require that chief AI officers, managers, and AI practitioners have the relevant expertise to manage equity considerations. It recommends recruiting and hiring a diverse workforce and requires consideration of diverse perspectives in AI governance. For years, the disability community has had a mantra, nothing about us without us. This has been morphing into just nothing without us because the relevance of so many topics to people with disabilities is overlooked unless people with disabilities are in the room. There's a need for people knowledgeable about disability in AI development, risk assessment, privacy assessment, design of accessible human bypasses for automated decision-making, AI innovation, AI governance, and more. Please let us know your advice for ensuring an AI workforce that has the relevant expertise to manage disability equity considerations. Also, your advice on how to ensure input to AI governance from people knowledgeable about AI and disability experience. Thank you again for the chance to provide this background for the Access Board's hearing today and for the presentations and comments that we will hear next. There are many equity protecting practices in these AI documents, and we need all of your perspectives on disability considerations to implement these effectively. Allison, back to you.
I believe we're actually going back to Elver.
Elver, back to you.
Thank you.
Thank you so much. Yes, indeed. Thank you, Judy and Allison, for that foundational information. We will now transition to the panel presentations part of the hearing. Now, panelists will be sharing general artificial intelligence benefits, artificial intelligence risk, and touch on current research, employment, and other related AI topics. We ask that all panelists keep their presentation to around 8 minutes, and if they have slides, they should be prepared to share their screen at the time of their introduction. As a reminder, please keep your cameras off until it is your time to present. We ask that all others remain muted with cameras off. Let's begin with our presentation. We now welcome our first presenters, Henry Claypool, technology consultant, American Association of People with Disabilities, and Ariana, please apologize if I am mispronouncing your names, Ariana Abulafia, Policy Council, Disability Rights in Technology Policy, Center for Democracy and Technology, for their presentation on MOU Partner Insights on AI for People with Disabilities. Henry and Ariana, you are welcome to begin.
Thank you, Elver. I first am going to just recap our work before we hear from the rest of the panelists. we're very pleased to have this opportunity to partner with the Access Board on to ensure that AI is deployed in a trustworthy manner. And in doing that work with the Access Board, we hosted an initial webinar. That webinar was a foundation on AI and disability, and a link to that can be found on the Access Board website. Some of the material that was covered in the webinar includes definitions of artificial intelligence, machine learning, and generative artificial intelligence. We discussed the uses of AI, why federal agencies are using artificial intelligence, and how people with disabilities are using AI. How AI can impact, we also covered how AI can impact people with disabilities now. And unfortunately, it's having discriminatory outcomes in areas of employment, when it's being used in the recruiting process and hiring process, when it's used to monitor employees and their performance. It's also having some adverse outcomes in the administration of government benefits. And in healthcare, algorithms are being used to determine treatment, level of care, and other types of determinations that allocate the healthcare resources that so many disabled people rely on. Today's listening session provides the Access Board and AAPD and CDT another great opportunity to center the experience of people with disabilities in AI to understand its impact on our community. Through this learning, we hope to gain insight into how to foster dialogue with federal agencies on the use of AI, and in general, continue to raise awareness of how disabled people experience AI as it proliferates. Forecasting our next series on August 22nd, we'll be hearing from federal agencies and other practitioners on how they're using AI. And then finally, our last public meeting of the year will be towards the middle of November, and it'll be about the time that, as Allison referenced, the Access Board is releasing a report. AAPD is also planning to work on a best practices document, which can be used to support future work on AI and hopefully continue the dialogue with federal agencies. And with that, we look forward to hearing more from our panelists today and others in the public hearing. Again, thank you, Access Board, and I'll turn it back.
Thank you, Mr. Howard. We will continue now with our third presentation. We will hear from Dr. Ariel Silverman, Director of Research at AFB, American
Elva.
Foundation for, I'm sorry.
I'm sorry to interrupt, Elver. The second panelist is Howard Rosenblum. So if you go back in the notes, Henry was panelist 1. Now we'll go to Howard.
Oh, my sincere apologies. Okay. Yes, I got. Thank you so much for interrupting me. We will welcome Howard Rosenblum, Chief Executive Officer at Deaf Equality, for his presentation on the AI uses challenges in relation to communications access in employment, healthcare, every aspect of life. Howard, you are welcome to begin when ready.
Well, thank you very much. I want to thank the Access Board for allowing me to talk today about the impact of AI on people who are deaf and hard of hearing. My name is Howard Rosenblum. I'm from the organization Deaf Equality. There's been a lot of talk about AI in the deaf and hard of hearing community. First, some of the issues that we experience is that AI is based a lot on written language, which isn't inclusive. It's biased, in fact, against sign language. So their attempts have been created to make AI using sign language, but those attempts have been very limited. What has been created has been based on word order that is for spoken and written languages, not the word order of natural sign languages. So that issue needs to be addressed to be able to include the appropriate expertise to ensure full access for AI-generated sign language. We have a long way to go before AI or computer systems in general are smart enough to also read people's expressive sign language. It's one thing to be able to show some signing, but then to be able to understand what people are signing in a variety of backgrounds, that is going to be very complicated for these systems to be able to comprehend. Okay. When thinking about captions, first of all, captions are not always adequate enough for people who are fluent in spoken languages. If you have people whose first language is sign language, then that also adds another layer of complexity. Now, AI-generated captions are getting better and better, but that is reliant on many different factors: sound quality, background noise and interruption, and also the terminology being used and the level of complexity and specialization of that terminology. Now, that can be mitigated by putting some of those terms in the libraries that are used by the captioning systems, but often they are not and therefore are missed. Also, the number of people talking at the same time impacts the quality of AI-generated captions. People's various accents. If somebody's using the language that they're using is not their first language and they have an accent, then that can impact it. Also, the speed at which it's being spoken and how frequently people are speaking over each other. And then, of course, anytime AI is involved, you need to make sure that you have good connectivity, very robust, strong connectivity, so that the message is getting from the source to where it needs to go for the AI to work. And if not, then that can be highly impactful to the quality. I think about watching TV right now. Right now, TV stations all over the country are using automated captions, and you can see often that the result is not good. So that gives just a good example of how both AI can be beneficial and problematic when generating captions. Okay. Now, thinking about just out in general society, recruiters and different employers are using AI to screen resumes as they're looking for new applicants before they decide who they would like to invite to a round of interviews. And this is inherently biased against deaf and hard of hearing people because sign language is often not included in that process. And there's not time there for an accommodation. You're dealing with something quickly online. If you're asking for an interpreter to be involved, that takes more time and therefore can't happen quickly. Also, if you're reading and looking at people's ability to type a response, often you're looking for something very quick, and that screens out people who are deaf and hard of hearing who may take longer to respond. Also, many industries like the hospital industry, banks, hotels, restaurants, utilities, and other service providers are now using AI to service their customers, to answer questions, to make reservations, to make changes in services and appointments and so forth. AI often isn't accessible for deaf consumers because when you make that connection, often they're looking for a very quick response. And then also, if you're going through a phone system and you're using the relay service with a sign language interpreter, that naturally takes time. And so what ends up happening is deaf people get cut off because they're not responding in a quick enough time because of just the very nature of the relay service. So another way to be able to call in and have a conversation would be to get your reservations made, or whatever service request you need to be made needs to be available. So that's problematic. We also see emerging technologies coming about, like kiosks, or even automatic driving, telehealth services, and all of these new emerging services favor spoken communication. They don't favor text communication. That's thought of as secondary. Okay, so just thinking also about the information gaps in AI, I have a bit of a humorous story, I hope. So, AI often doesn't take into effect cultural information and general knowledge, and marginalized groups are often not considered in its knowledge base. So, for example, just for this, I was playing around with ChatGPT. And so I went in and I asked ChatGPT questions like, can you give me the name of deaf attorneys? So I am a deaf attorney. So at first, I asked, and it gave me 4 names, none of whom I knew. So generally, I know most deaf attorneys in the country. So I decided to Google them. And none of them even existed. These were just apparently imaginary people. So I said, let me try again. So I asked the same question again, and I got 2 well-known actors, advocates, but not attorneys. Maybe has played one on television before, I don't know. And then 2, again, just imaginary made-up people, people that weren't real. Okay, so 3rd time's a charm, right? So I got more responses, and I saw my name there, which was surprising. But I also saw a judge in California who is not deaf, and some more imaginary people. So then I thought to myself, well, let me ask a different question. How do I find the most qualified deaf people to hire for a job? So that's the question I asked, right? And I got a list of names. But there were 2 organizations listed on there, and both of those organizations did not exist. And then I asked another question. I said, can you tell me the name of deaf leaders? And I got 8 responses. 6 of those responses are well-known leaders. So great. The 7th response seems to be an imaginary person. And then the last response was Dr. Mark Moreau, who is well known to be a blind leader, the former president of the National Federation of the Blind. So, as you can see, AI is not that intelligent sometimes. Well, anyway, we have to be very careful about the reliability of the responses we're getting and really consider accessibility in different ways. It's a game changer. It's going to help a lot of us. At the same time, we need to make sure that the designers, the engineers, the innovators, the people that are really making that and are looking at that data reflect the life experience of people with disabilities, and not just an ableist view. We want something that's fully accessible. We need redundancies in place to make sure that communication access is available, not just via spoken and listen ways, but also via ways like American Sign Language. And then people who are deaf and blind also need to be able to have access to information via a tactile mode. So all of these considerations need to be considered in the efforts with AI. With that, I want to thank you for your time and look forward to the rest of the panelists and what they have to say. Thank you.
Thank you, Mr. Howard. Certainly, I wanted to hear your presentation, so I was just a little bit confused with my note, but thank you, sir, again. Now we are going to continue with our 3rd presentation. And we will hear from Dr. Ariel Silverman, Director of Research at AFB, American Foundation for the Blind, on their research on artificial intelligence, generative artificial intelligence in education, use of screen readers, and how they function across platforms. Dr. Silverman, you may begin.
Thank you so much for the opportunity to be here today. Thank you to the Access Board. I'm actually going to be giving a little bit of preview from a research study that the AFB's research department has been working on this year. But I emphasize that the findings that I'm going to talk about today are very preliminary, and we should have a more finalized report from the findings in early 2025 that will be available to the public. So the American Foundation for the Blind is a national nonprofit that seeks to promote equal opportunities and expand possibilities for people who are blind or low vision through advocacy, thought leadership, and strategic partnerships. It's our new mission statement. The first time I've been able to say the whole thing from memory. Great. So a lot of our advocacy and thought leadership work has been focused around technology that plays really a pivotal role in the lives of everyone. You know, during the pandemic, we recognized how dependent we were on technology as a society, but then of course, people with disabilities also rely on assistive technology. People who are blind or low vision rely on screen readers, screen magnification software, et cetera, to be able to access information. So a lot of our research kind of up until this year has been focused on identifying and documenting the harms that blind and low vision people have experienced when technology is not made fully accessible. But for this new project related to artificial intelligence, we wanted to try to anticipate ahead of time what some of those harms might be, and also what some of the benefits might be for AI as it starts to roll out and become more ubiquitous in people's lives. So we are conducting a Delphi study, which for those of you who are not familiar, is basically like a asynchronous focus group with 32 experts some are from industry, some are from academia, some are from nonprofit sector, and a few from the federal government sector. And we started off by conducting interviews, and then now we're doing these questionnaires where we're having the participants rate their level of agreement with the opinions of other people in the panel in order to try to establish consensus on some of these areas. So I'll talk about a few areas where the panel has already reached consensus, and there are other areas that are currently in progress. So first of all, in the domain of education, the panelists recognize that AI can have a lot of benefits for students with disabilities, and some of them believe that AI can really help individualize and personalize education. However, there are also a number of concerns that were raised by the members of the panel, including the possibility that AI used in education may be rolled out without being tested for accessibility. The impacts of AI surveillance, which could disproportionately discriminate against students with disabilities, or misconceptions where AI might be used as an accessibility tool and teachers might falsely believe that the AI encourages cheating. So those are some of the risks of AI potentially being used in the education domain. In the transportation domain, we've had a lot of conversation about autonomous vehicles and automated driver assistance systems, which of course are rolling out more and more. We are already seeing Waymos on the road in a couple of states. And these systems have great potential for people with disability, with a variety of disabilities who cannot drive, including those who are legally blind. However, there's been very little testing of these systems with disabled people directly. So there are some concerns about AVs not recognizing disabled pedestrians, like people using wheelchairs or people using white canes on the road. There's also concern that the vehicles themselves might not be accessible for people with physical disabilities, or that the apps and the digital systems governing those vehicles might not be accessible for blind and low vision users. Also, there are potential concerns about things like autonomous vehicles being hard to locate by someone who's blind or low vision because there's no driver to shout out the window and notify the blind person that they're there. And then on the other end, at the destination side, if the AV drops off in the wrong spot, which we know GPS can be flawed technology, or if the GPS drops off, a ways away from the destination, the blind low vision user might have some difficulty. So we need safety, accessibility, and non-discrimination standards for both the AI systems and the physical vehicles. In the employment domain, Howard Rosenblum made some excellent points about AI being used in resume screening. The expert panel has unanimously agreed at this point that there must be a human in the loop to review automated screening decisions. The panel also agrees that, and this is not happening yet universally, the panel also agrees that all job candidates must be notified when AI reviews their applications. So there are definitely some pretty blatant concerns about AI discriminating against job candidates with disabilities. In the healthcare domain, concerns abound about the use of AI to make health insurance coverage decisions or eligibility for benefits, including Medicaid, disability benefits, and so on. People with disabilities usually have some non-typical or uncommon healthcare needs. A lot of people with blindness or low vision, for instance, may have rare genetic syndromes. They may have eye cancers. They may have other kind of multi-system conditions that can cause health problems later in life. AI that's trained on the average person can easily miss those needs and flag them for denial simply because they're unusual if the AI is not properly trained with data from people from a variety of health conditions. Additionally, the FDA has now authorized more than 900 machine learning and AI-enabled medical devices, but their guiding principles currently do not include disability as one of the characteristics to consider to find and eliminate bias. So we absolutely need guidelines and standards that center representative data, evaluation, transparency, and reporting on how AI-enabled medical devices work for people with disabilities. Improving testing and reporting will help both patients and healthcare providers who will be using the systems. And then finally, representation. According to the National Science Foundation, only 3% of STEM professionals, science, technology, engineering, and mathematics professionals, are people with disabilities. Our panel has reached consensus on the idea that the tech industry needs more diversity in its own employees to be able to spot and guard against the many types of bias AI can generate. Part of that diversity includes having more people with disabilities at every stage of tech development, not just at the end with beta testing, but at every stage of development. Our panel also has reached agreement on the idea that regulation needs to ensure people with disabilities are proactively considered in AI development, not reactively considered after something goes wrong. Recruiting and training disabled professionals is vital for building a workforce that creates and uses AI in inclusive ways. And I love the stories that Howard shared about asking AI questions. We at AFB were playing around a little bit too, and we asked ChatGPT to draw a picture of a blind person. It shouldn't be very hard. And some of the pictures that it generated were pretty hilariously inaccurate, including some that had blindfolds or bandages over the person's eyes, which is really not realistic. Asking it to draw pictures of white canes and other mobility aids also came up with some really inaccurate representations, suggesting that these commonly used AI platforms desperately need more representative training data from people with disabilities. We need better guidance and standards for producing accessible training data, testing and validation, and reporting on potential and real anticipated bias. Thank you very much, and I look forward to answering any questions at the end.
Thank you so very much, Dr. Silverman. Very, very interesting. Appreciate it. We are going to continue now with our fourth presentation with Dr. Damian Patrick Williams, who is an associate professor at the University of North Carolina, Charlotte, on cross-disability AI research, algorithmic bias, and cross-disability employment, and how AI use may affect the civil rights of people with disabilities and how to prevent discrimination and misuse of information. Dr. Williams, you may begin.
Hello, and thank you all for having me here today. I very much appreciate the time and the panelists who have spoken thus far. I want to highlight some of the things that we've kind of already discussed. Somewhat we've already discussed the use of artificial intelligence and tools like benefits determinations in facial recognition and surveillance systems, both within education and in the workplace. But also we need to think about the use of facial recognition and surveillance within carceral contexts such as policing. And the kinds of determinations that get made by algorithmic systems in the judicial setting as well. We've talked a little bit about resume sorting, the use of AI in determining what kind of person gets what kind of job, and the protections that need to be put in place in order to ensure that there's no harmful, discriminatory, and prejudicial bias within that space. Unfortunately, we know that there already is bias within those spaces. What we can do to try to prevent that from happening again, but also to repair the harm that's been done so far is a little bit of what I'll talk about today. Before we get started in that, I'll give you a little bit of background about the work that I do. As said, I'm an assistant professor. Excuse me, an assistant professor of philosophy and data science at the University of North Carolina at Charlotte. I've also worked in an advisory capacity with the Center for Democracy and Technology. I've worked with the Disability Inclusion Fund on their technology funding stream. And I work currently on a grant with Dr. Ashley Hsu from Virginia Tech. We have a grant from the Andrew W. Mellon Foundation looking at how to bring disability-focused and disability-forward research consulting services to technology teams, both in the academic research space, but also in the enterprise and business space. The idea behind this is bringing disabled consultants with lived experiential knowledge and expertise into conversation with researchers who are building technologies that will be used sometimes specifically for disabled users, but sometimes intended to be used outside of what would typically be considered the usual realm of use for disabled individuals, architectural design firms, for instance. And the idea behind this touches on a lot of what's been said by some of the other presenters. Bringing disabled lived experiential knowledge, the direct expertise of what it means to be disabled in multiple ways into these research spaces brings something that benefits the research directly, rather than asking after the fact, oh, did we remember to consider disabled people? We ask research teams to consider at the very beginning and then throughout the process, what can disabled individuals and groups teach us about the work that we are trying to do? What can partnerships with disabled experts bring to our research that would otherwise be lacking? My work at UNC Charlotte, I've worked on a number of different artificial intelligence projects, trying to bring AI and these kinds of principles into both the business space, but the research and academic space, bringing partnerships to local and kind of regional partners as well. And when thinking about these tools and these systems, oftentimes my concern is about multiple different forms of marginalization and minoritization. Race, gender, sexuality, and especially disability. The multiple different ways that people can be marginalized allows for people to understand the world in different, intersecting, overlapping ways that brings something to the research that we can do. It teaches us something that, again, would otherwise be lacking. When we see inequitable outcomes, when we see a harmful prejudicial bias show up within algorithmic systems, we see those things because no one fully heeded the people who spoke up in advance and said, these types of systems or these types of thinking, which are embedded in these systems, harms people like me. It harms groups like myself. How do we then prevent it? In order to think about how to prevent it, we have to think about how these things make their way, these biases, these prejudices, make their way into the systems that we build. When we think about artificial intelligence, as has been noted a couple of times, we're thinking about multiple different systems that kind of get labeled under the header of AI. So when we think about benefits determination systems for use in Social Security disability benefits, or when we think about health insurance, or when we think about hiring, surveillance, and facial recognition, many of the systems in the backgrounds of these tools are called AI. But what they are and how they function might be drastically different from each other. They might be machine learning systems, or they might be natural language processing based large language models, what we tend to think of when we talk about ChatGPT systems or DALL-E, the art system, the image generation system, or Midjourney, which does similar things. All of these tools get labeled AI, and they have similarities and they have overlapping processes, but they do their chosen their preferred functions in very different ways. And so when we think about how we want to make these changes, we have to think about how the bias that already exists within these systems makes its way into them and what we can then do to prevent it. These systems are all trained on data that has been gathered from various sources. Oftentimes it's scraped from the internet, as in the case of generative AI. Sometimes it's pulled from mugshot databases, as in the case of facial recognition systems used for policing. Sometimes it's scraped from whatever public data is available or sold by data brokers, something which is increasingly being called to be regulated. Groups of people who can package whatever it is that you do online, connect it up and sell it as a profile of an individual or a group of people. But within all of these different forms of data, there are biases that already exist. Ways of thinking, ways of talking about, ways of acting around certain types of people, which get built into the data itself and which then get trained for when the system is designed. When we train these systems, we are making very careful, minute adjustments into how they consider certain data points more or less than others, making very specific choices about how it should weight and consider certain types of concepts. And then we're putting those systems and how they work out into the world. If the biases, the prejudices against disabled people already exist within the data, and if those biases and those prejudices exist within the people who are doing the data collection, who are doing the data organization, who are doing the weighting and calculations that will make these systems function in the ways that they do, then we will find that those biases and those prejudices will very clearly make their way into those systems in the ways that we've talked about so far today. When a system doesn't have enough images to build a picture of a blind person or someone using a white cane, it's because no one thought to include enough pictures of blind people for that system to have a breadth of representation to pull from to accurately represent it. Or no one has properly tagged those images it does have so that it understands, as much as these systems understand anything, how to correlate the words we associate, white cane, blind user, with the concepts and the pictures that would be represented in its data sets. We need to have disabled experts involved at every stage of these processes, not just because it is more just and more equitable, it is those things, but because it creates better outcomes. It makes these systems work better. When we don't have disabled experts, lived experiential expertise involved in these processes, the biases, the prejudices, the failures, the harms become obvious. And they happen at drastically increased rates. If we want to undo those harms, if we want to prevent them from happening again, we have to be careful about how we build these systems, not only what data we use, but how we train that data and who is doing the collection, the sorting, and the design of it in the first place. Thank you all for your time. I'll hand it back.
Thank you so very much, Dr. Williams. Now we are going to have our final presentation of the day, and we will hear from our last presenter, Dr. Jennifer Mankoff, who is the founding co-director of CREATE at University of Washington, for her presentation on AI research, including the impact on resume review, use of AI, and potential employment discrimination in AI hiring tools for people with disabilities. Thank you, Dr. Please, Dr. Mankoff, you proceed.
And I'm just putting a link to my slides in the chat and sharing my screen. Great, can you see my slides?
Yes.
So thank you for having me. It's an honor to be coming after this group of speakers, and I hope what I say won't be too repetitive of some of the things they have already pointed out. There's a link to my slides in the chat. I'm a white woman with short curly dark hair. I'm wearing a blue shirt. I use she, her pronouns, and I have a disability. And I want to talk today about the incredible potential and some of the risks disabled people face when using AI, based on research done at CREATE and other research as well. So this talk is based on a series of studies, starting with a 3-month case study last spring that included 5 disabled researchers and 2 non-disabled researchers who committed to using AI for any task that they could imagine and writing down what happened shortly after ChatGPT and other tools came out. And we found that AI met many important needs in this work, and I'm going to talk about a few of them now. For example, my slide shows a picture of Gmail's Help Me Write AI interface, which has come out since that study. In our case study, one author used ChatGPT to help edit emails and chats. They wrote, "Socially rubber ducking with an AI made me feel more confident than writing alone," and this helped them with their communication. Long documents or papers can also be accessible to people, for example, with various cognitive impairments. Groups such as New Disabled South are using AI to help simplify important texts, such as policy texts. And our case study showed that people are using AI themselves for this kind of task. In this example, ChatGPT has been asked to simplify a famous paper called Sparks of Artificial General Intelligence about AI use. And one of our authors with brain fog used AI for this kind of task. Another important use of generative AI is image exploration. This is a really powerful opportunity, and it's available already in apps such as Be My AI that are used in the blind community. Illustrated at right is a phone showing a picture with the Be My AI interface of the inside of a refrigerator. Unlike alt text, these apps can answer detailed questions about images, such as whether there's a watermelon or a lemon or something else in the fridge, and support non-visual exploration. AI is also helpful for ideation. One member of our case study wanted to crochet a husky with purple clothing, the mascot of UW, in UW colors when they joined our university. They felt their non-AA sketches were rough and hacked together, but AI was efficient, producing 4 adorable pictures from one prompt shown at right, with goggles, hats, and jackets in purple, and providing flexibility and choice. One of the amazing things about AI today is how flexible it is. People are discovering new accessibility solutions, things that didn't exist before because of its flexibility. They're also improving on existing solutions and finding new opportunities for solving accessibility problems. AI, our study showed, has incredible potential. However, emerging research, including that study, have also shown that AI can make mistakes and be ableist. And I want to talk about some of those risks now. First, use of AI depends, of course, on accessible interfaces to AI. And these interfaces need to be accessible not only in asking AI questions, but also configuration, verifying the results and other things like that. And I want to talk particularly about what I mean by verification. Many disabled people use AI because something is inaccessible to them, like an image they can't see or a document they can't read. But if AI makes a mistake when it describes that image or simplifies that document, how does a person verify? How does a person make sure that that result is correct? If they are blind and can't see the original image or can't read the original document, they might not know whether the AI made a mistake. And we need new research to understand how we can make verification more accessible so that people can trust the outputs of the tools they are using. Also, and others have already talked about this today, AI can be especially error-prone when in areas to do with accessibility or disability, and it is ableist. For example, this image of a young boy sitting in a wheelchair with his arms around his knees, looking sad, is AI generated. It's part of a study by Mack et al. That found that AI generated images of disability are overly negative, among other problems. We need to improve data representation, as has also been mentioned, including diverse people with intersecting identities and disabilities in our data. And we need also to study and assess the prevalence of ableism and the kind of subtle things that come up even when representation is quote unquote accurate to address these risks. But I also want to talk about what I call indirect risks to disabled people of AI. So what we just saw were risks that somebody directly experiences when a person with a disability asks AI to produce content. But people with disabilities may be subject to AI even when they are not using it themselves, as is the case with resume screening. So we've heard multiple people talk about hiring. And I want to talk about a study that we did, which used what's called a resume audit method to check what level of bias existed in ChatGPT. Imagine for a moment that you are a hiring manager evaluating resumes. Here's a very small portion of a long resume showing an awards section for a research intern role. And on the screen, you can see highlighted the Tom Wilson Leadership in Disability Award and the Students with Disability Scholarship. Now imagine that we remove these 2 disability awards. As a disabled job seeker, I've been told before that my disability might affect my hireability. This is a common experience shared by many people with disabilities who have to decide whether and when to disclose disability, even in the positive context of an award or scholarship. We wanted to know whether AI has this kind of bias. So we gave ChatGPT the 2 resumes I just showed, including all of the hidden material as well. And they were identical, except that one was missing 4 disability items. We gave ChatGPT 10 chances to decide which was better, and we tried this for 6 different disabilities, including blindness, deafness, autism, cerebral palsy, and depression. And we asked ChatGPT, you are an experienced hiring manager. Rank these 2 resumes, list pros and cons for each candidate. What should have happened is shown in this bar chart where all 10 examples of ChatGPT ranking each resume for the 6 conditions would have gone to the resume with the disability items as the top ranked resume. What actually happened was very much the opposite. resumes missing disability items were ranked first 75% of the time. In this chart, again, the x-axis shows the number of times a resume was ranked first, and the lighter blue portion of the chart shows the CV missing disability items was ranked first. The dark bars show when it was ranked, when the CV with the disability items was ranked first. For example, the top bar shows that the autism CV missing the disability items was ranked first all 10 times, even though it was less prestigious. ChatGPT's attempt to justify its choices was quite ableist. For example, it described the CV with autism as having less emphasis on leadership roles in projects and grant applications, despite having an additional leadership award over the competing CV. Similarly, ChatGPT stated about the depression CV, involvement in mental health and depression advocacy, while commendable, may not be directly relevant to the technical focus of the role. It then proceeded to rank the CV that did not mention any depression first 8 out of 10 times. We were able to demonstrate that anti-bias training could help by creating a custom GPT. The anti-bias GPT ranked resumes with disability items first more often than the AI without anti-bias training. All of the dark blue bars in this chart, which are all showing more first-ranked resumes than the light blue bars, are the results when we use the anti-bias GPT. However, the improvements were much higher for disabilities like blind or the generic term disability. And for example, in the case of depression, there was no improvement at all in the anti-bias CV. There's a lot of work still to be done to figure out how to remove these sorts of biases. This is not just a theoretical exercise. AI is used for hiring today by the companies shown on the screen and others. And also things like ChatGPT are used by everyday people ranking resumes. There is no way to know about every case of AI use or how biased these kinds of systems are. So in addition to better bias mitigation methods, we need information about whether and how AI is being used. We need standard accessibility benchmarks about bias and minimum standards that companies must demonstrate that they meet. And we need people with disabilities, as has been said before, to have the training and job opportunities to be included when these systems are designed and built. And then we need them hired as well to help ensure that the right questions are being asked and the right studies are being done to make sure that these systems are not biased. To summarize, AI use is inevitable, powerful, and promising. Responsible AI use with the input and contributions of disabled engineers, makers, designers, and users is the future we want. Thank you.
Thank you so much, Dr. Markov. And I want to again thank all our presenters for your informative presentations. They are very indeed greatly appreciated. This concludes our panelists' presentations. At this time, we will now open it up to Access Board members and staff if they have any questions for any of our 5 presenters. Please note that members of the public will not be permitted to ask questions directly, but they may enter their questions in the chat for the record or email ai@access-board.gov if they have any questions of any of these presentations. Do any of my board members have a question? If so, please raise your hand. When called on, please unmute yourself and introduce yourself before speaking. I am going to ask you, dear Amy, if you can please assist me and look if there is any other board member with a raised hand so we can.
Yes, Elver.
Thank you.
And the question and answer is also open to the presenters and any Access Board staff at this time as well. So if Access Board staff or presenters have a question, it looks like Dr. Williams has a question. Dr. Williams, you can go ahead. And again, encouraging board members, if you have questions or comments, please raise your hand and we'll call on you at this time. Go ahead, Dr. Williams.
Yeah, thank you. First, I wanted to thank Dr. Minkoff for the presentation there. That work that you all did in showing the bias in the ableism within resume sorters is something that I've been talking about and passing around quite a lot. So thank you for talking about and highlighting that a bit today. I wanted to actually ask if we could dig down a little bit more on some of the what are often called hallucinations that happen in generative AI, specifically large language models like ChatGPT. Specifically, if we could, for those of us who want to and have a kind of direct experience with it, if we could talk a little bit more about what it means when those things show up. And how they come to pass. Those of us who've used it, we're pretty well aware at this point that ChatGPT, Google's Gemini system, pretty much every large language model based system like that out there right now will randomly make stuff up. As Howard pointed out, and ask for any list of anything, you'll get something that's maybe correct or maybe sounds correct. But is oftentimes just completely fabricated. And I don't know how many in the public really understand how inherent that is to a lot of what large language models are and how they function. So I was just wondering if anybody would like to have a little bit more of a conversation about that.
This is Jen Mankoff. May I respond to that?
Please.
Yeah, I think that is such an important topic. And I think that part of what we need to do as a community is both develop AIs that are better at it, but also develop clear guidance for people using AI to know how to better mitigate that. For example, when asking ChatGPT for information, you can ask it to provide references for any information that it gives you, and it will add links to the lists it generates. And then if you have the capacity, you can click on those links and see if it leads to a real web page, whether the content in that page agrees with what you found. Those kinds of strategies need to be made visible to the disability community, I think, to help people with that kind of verification task that I mentioned and to build that into their practices.
Yeah, I think that is really important, and it kind of gets to something that I try to promote to my students as well, which is a level of critical thinking about these things. That criticality that you mentioned, of check the link that it gives you. If it gives you a reference, put that reference into your library search engine and see if that reference actually exists, right? Like, don't take it at face value that what it gives you is necessarily going to be true or correct, but that it needs to be checked. As you said before, and as others have noted, there has to be a human in the loop. There has to be some human being involved to verify against these things. Just because by their very nature, some of these systems they will make things up.
Thank you both. Looks like we have a question from Allison Levy. Go ahead, Allison.
Thank you, Amy. This is a question for all of our panelists. We have a lot of people with disabilities in the audience today, and I think we've heard consistently from all the presenters that people with disabilities need to be part of this development of data collection and use of AI. What are some ways that people with disabilities could become more engaged or involved and the research and development that's being done today in the AI space. Are there any recommendations from our presenters that could be shared for our audience?
This is Ariel. Can you hear me?
Yes.
Yes, your camera just needs to be lowered a little bit if you have that option.
Gotcha.
Perfect. Thank you so much.
Yeah, no problem. I think one way that people with disabilities can get involved is to participate in research studies. And I've already seen, at least in the blindness space, a number of academic researchers who are seeking participants who have been using Gen AI specifically. And, you know, American Foundation for the Blind will probably also be doing some research. So I would encourage people with disabilities to kind of look out for announcements of relevant research studies that academics or nonprofit or government entities might be conducting to try to systematically look at their experiences and opinions about AI. I know at least in the blindness space, there are email groups, social media, Facebook groups for people who share a disability, and those groups often receive research recruiting requests. So that might be one way to get information about those studies.
That's really helpful. Thank you. Dr.
This
Williams?
this is Damien. I would also add on to that, in addition to keeping an eye out for an ear out for research studies. You know, Henry at the beginning, Dr. Brewer, several of us have talked about the opportunities for research consulting that comes up as well. And the opportunity to just reach directly out to groups and offer perspectives. So don't be shy or hesitant to reach out to groups, to public policy workers, to researchers who might have suggestions or who might be doing that kind of work as well. I think that unfortunately, it needs to be on a kind of collective action side until it is more the norm within researching to reach out to disabled individuals and communities.
Thank you. I'll turn things back to Amy to facilitate additional questions that seem to be coming in.
This is Jen. I'm sorry. Can I just add one thing to the question that was just asked?
Absolutely.
Yeah. If you are in higher education, if you're interested in getting a degree so that you can get involved in building these technologies, I encourage you to reach out to organizations like Access Computing, which works to ensure that people with disabilities can succeed in these kinds of degree programs. And I also just want to say that there's a really wide variety of ways that people can contribute to doing AI work, including prompt engineering that doesn't necessarily require a computer science background, studying how AI is being used and helping with those kinds of things. And also, obviously, working in fields like computer science. And we need lots more people with disabilities in all of those areas. I would also encourage people to take a look at some of the recently created or long-term NIDLR research engineering centers like TRACE, newly create the Deaf and Hard of Hearing Center at Gallaudet. These groups are doing disability-led research, and they are always looking for community partners and individuals to take part in the work that they are doing. So there's a lot of opportunities in those spaces that I just wanted people to know about. Thank you.
Thank you so much. I saw Howard go ahead, and then we'll go to Judy.
Thank you so much. Just making sure the interpreters are organized. I find that one of the challenges that we're seeing here is that it's a lot of the work that's being done by corporations like Google, Microsoft, WebEx, and the like are hiring people with disabilities to work in the field. But I think we need a little more pressure to get them in higher positions so that their development of technology, including AI, the development process itself is inclusive. So we need to encourage more people with disabilities to go into the field of the data sciences, computer sciences, so that they are part of the solution from the beginning. So when we're looking at the research that's been happening, as has been mentioned, it's all obviously very important, but we also need those people at the table in the employment sectors where that technology is being developed. That includes the universities as well as those research spaces. So we need to be at the table everywhere.
Thank you, Howard. Judy, go ahead.
Thank you. This is such an important discussion, both in terms of getting people at the table and also surfacing some of this research on the impact of AI for people with disabilities. I encourage researchers to get any published materials as rapidly as possible into centralized research repositories of disability relevant AI research. Sometimes the policy opportunity to take advantage of newly available research is just a few hours window in the middle of a weekend. And so discoverability of this research that's becoming available is especially important if there are ways to facilitate that. Thank you.
Thank you, Judy. At this time, I just want to remind that the question and answer are for board members and staff members of the U.S. Access Board and the panelists, presenters at this time. Dr. Williams, did you have another comment or question?
To follow up, yeah, sorry, this is Damien. Just to follow up on what Judy was just saying about centralizing, would we have the opportunity to provide some of our research materials, or at the very least a list of references to be appended to when the website goes live with this recording? Can we add some things in?
You can absolutely send us any materials and links, and if you have the links readily available, you're welcome to enter them into the chat for everyone's awareness as well.
Fantastic. Thank you very much.
Thank you.
Dear Amy, is there any chance for me to ask a question?
Absolutely, as the chair and as a board member, of course.
Thank you. Thank you so very much. Well, to all our presenters, when I think of artificial intelligence, I think of it with optimism, but also with a concern. Optimism because what is going to bring me, what new is going to bring to my life to continue an independent living, but also to help me to accomplish my goals. But with a concern in terms of what is going to take away of me. So if you can't maybe recommend, or if there is an answer for this question, but there will be an area that you will not recommend to use AI. It could be financial, education, health, everything that is related to just a regular human being living in this world. So is any area that you will not recommend AI?
Do any of our panelists have a response for our chair's question?
I do. I'll sorry, this is Damien, but I heard someone else's voice as well. If someone else would like to go first.
Go ahead.
Okay, sorry. I strongly advocate against the use of AI in carceral systems, policing, judicial system, both in terms of facial recognition and in terms of sentencing algorithms. There has not yet been proper remediation of the types of harms that get done when facial recognition algorithms and algorithmic sentencing tools are used within those spaces. They are predominantly biased against Black and Brown communities and Indigenous communities. The harms that facial recognition systems do for Black individuals, but also for disabled individuals, has been well discussed today. And I think that even when those systems work, quote unquote, perfectly, they are used in such a way that tends to be disproportionate in its application. That is, it is more often used against certain types and groups of people, even when the system itself is corrected against for the biases that often show up in its operation. So I tend to argue pretty heavily against using those types of systems in those types of spaces.
This is Jen. I would add to that a very important concern that AI's biases reflect and are often worse than, but feed into the biases that exist already in human society. These biases didn't just come from unrepresentative data, they also came from data that shows the same biases that are being repeated by AI. So I do have concerns about how human oversight that isn't very carefully informed by an understanding of disability bias would function, and whether we can truly mitigate AI bias simply by having a person just take a look and ask themselves, is there a bias here, without very careful processes and check and balance kind of systems in place. So I would suggest also, for example, when it comes to hiring, that it might be premature to use AI for resume screening, for example, for similar reasons. It's not enough to just have a person look, typically, to overcome these biases.
Please, Mr. Howard, proceed.
Thank you. This is Howard. As an additional answer to the question about where not to use AI, I think several of the presenters have actually already touched on this. It's not recommended for employment due to the manner in which AI filters out applicants. So that is certainly one. Another area that I personally think where it is a little dangerous is in any medical situation where the importance of the information and that communication exchange are to ensure appropriate care for the person. And that can be physical health or mental health. I also think that there are some concerns that may lead to mistreatment and bias against persons with disabilities who may need healthcare being denigrated. So I think employment and healthcare are two of those scenarios where AI should not be used.
Thank you so very much. I don't think so that I see any more questions from our board members to the presenters. If that is the case, so again, I want to thank all the presenters for this informative and valuable information. I think that this is a time for us to go now to another portion, which is the public comments. The public comments portion of the hearing, which is to hear from the public on the intersection of disability and artificial intelligence. For those that pre-registered, as mentioned at the beginning of the hearing, please ensure that your name in Zoom appears as your full name that you registered under so that we can provide you the permissions to unmute and turn your camera on. We are interested in hearing about your experience with AI, accessibility barriers, concerns, and ways that AI has also benefited people with disabilities. We want to learn about your experiences and concerns related to AI. It's very important to those 2 points. Each pre-registered speaker will be given 2 minutes. Amy Nieves, Public Affairs Specialist, will call on speakers by name and assist with unmuting as needed. Finally, I just want to note that our board members are here to listen to your comments, but we will not have time for dialogue in this forum. Okay, let's get started. Amy, would you please call the first registered speaker?
Thank you, Elver. At this time, I just want to remind again to anyone that had pre-registered, please check in the participants part of your name that your full name is what is displayed so that we can make sure to provide you the appropriate permission so that you can turn your camera on and unmute. At this time, I'm going to call our first registered speaker. When you're able to unmute, please state your full name for the record, as well as an organization that you represent, if applicable. So is Sandra Ross with us today? Sandra? Okay. I'm going to call it one more time. Sandra Ross. R-O-S-S. Sandra, are you with us? If so, please raise your hand. I'm not seeing anyone on the participant list by Sandra or Ross at this time. So I will move to our second registered speaker, which is Ken Meeker. Ken Meeker. I'm checking the participant list. I am not seeing Ken Meeker currently in the Zoom meeting. I'll move to the next one, which is Albert Fox Kahn. Albert, are you with us? I'll call a second time. Albert Fox Kahn, C-A-H-N is the last name. Okay. And the only remaining pre-registered speaker is, and I apologize if I'm mispronouncing it, Sean Steele Lockhart. Steele Lockhart as the last name. Sunho Steele Lockhart, I see you. I'm going to ask that you unmute, and we'll begin with your comment when you're ready.
Are you able to hear me now?
We are able to hear you.
Aha, excellent. Hello, everyone. My name is Sanho Steele Lashar. I'm the legal program coordinator with the National Federation of the Blind. And as several people have pointed out today, blind people and people who have low vision regularly are using AI for all manner of visual tasks. It is, of course, integral to our integration into society that we have some level of access to the visual world. It is a visual world after all. And AI has made that accessible to us in a way never before seen. However, we appreciate at the National Federation of the Blind the various concerns that people have. So on one hand, we understand the need for security and the secure storage, dissemination, and sharing of data that is used to access visual images and the world around us. On the other hand, we also appreciate how truly ubiquitous this has become for us, and the need both for us as blind people and disabled people generally to be involved in the building of these systems, and also to be allowed to utilize these systems. In July of 2024, the National Federation of the Blind passed Resolution 2024-08 on artificial intelligence, an abbreviated version of which we will post as a public comment before August 31st. And the National Federation of the Blind does resolve nationwide to be a part of these conversations to help balance both the security concerns for storage, dissemination, etc., and also to make sure that the information that we are able to utilize through these systems, though recognizing privacy concerns, also remains available to us so that we have access to facial descriptions, environmental descriptions, document descriptors, etc. That's all that I have today, and thank you very much for everyone who's put this on for us.
Thank you so much for your comment. At this time, I'm going to ask one more time if any of our other 3 pre-registered participants are with us. So Sandra Ross, Ken Meeker, or Albert Fox Kahn. This is your last opportunity to raise your hand or identify yourself so that we can allow you to speak your comment. Seeing that those participants are not with us at this time in the meeting, I will be passing it back to our hearing chair. However, I do just want to remind you, we will be continuing to put in the opportunities for you to submit your public comments, both in written form and at the upcoming participating hearings in the chat at this time. So I'll pass it back to our chair for our closing remarks.
Thank you so much. Very, very appreciated. And thank you indeed for our public comment speaker. We were hoping to listen the other ones, but maybe in the upcoming future, we will have the chance. We will begin with the closing remarks to conclude the hearing. As we end this hearing, I want to reiterate our thanks to all the speakers and attendees. I know that coming to a hearing takes some effort, and I appreciate that you made the time to come here today to provide the Access Board information on artificial intelligence. I speak for the Access Board when I say we hear your perspectives today. Your comments will help shape our efforts to create access for all, especially regarding artificial intelligence and disability. We have some reminders as we close on the screen now on the upcoming hearings, and also how to submit written public comments and how to stay in touch. There will be another hearing later today at 2 p.m. Eastern Time on Zoom. And as you see the slide, we can use the same link. We will guide you, we will take you for that presentation, and we can hear from additional presenters and speakers from the disability community. Additionally, there will be a hearing on August 22nd, 2024 from 2 to 4 p.m. Eastern Time, again on Zoom, and the link is on the slide on the screen. All hearing details are available on our website. At the August 22 hearing, we will hear from federal agencies and industry practitioners on best practices for AI regarding disability and accessibility. As a reminder, written public comments will be accepted until August 31st, 2024. For those that wish to share their public comments but did not get to do so during the hearing today, please email your public comments to events@access-board.gov. Include all written comments in the subject line. Include your name, organization if applicable, and a specific AI topic with your comment. Written comments are limited to 300 words. Also, you can reach the Access Board on the topic of AI by email to ai@access-board.gov. In our website, you can all hearings and all AI series information is available on our website as well. www.access-board.gov. Please subscribe to Access Board News to receive updates regarding the hearings and other news. This concludes the Access Board's virtual hearing on artificial intelligence. Thank you so very much.